webinar. Today you'll get a chance to ask your questions about nutrition, but before we dive in, I just have a couple of announcements. We host several of these free webinars throughout the year, so be sure and visit our website to see a list of upcoming presentations. The next one will be next Thursday, May 30th, when Dr. Jan Arundel will answer your questions about diagnostics, assessments, and working with a psychologist. You can learn more about that and other upcoming webinars by going to www.johnson-center.org and clicking on the webinars link on the right-hand side of the page. You can also join our email list there and stay up to date on all events and opportunities by clicking on the Join Our Email List link on the homepage. We also post news to our Facebook, Instagram, and Twitter accounts, and these are great sites to stay up to date on news like scholarship opportunities, research news, events, and more. And you can check out the library of our past webinar presentations on our YouTube channel at youtube.com/The Johnson Center. We currently have some terrific support programs. Sorry about that. We currently have some terrific support programs, including support and sliding fee scales for diagnostic services, counseling support, and more. If you'd like more information, please contact us at info@johnson-center.org. We have some great sibling camps coming up this summer with scholarships available, so contact us if you'd like more information. Our colleagues at the Autism Research Institute just launched a new website, so be sure to follow them as they host several great webinars and share some great resources on their website and social media pages. If you'd like a certificate of attendance after today's webinar, look for a follow-up email in your mailbox 1 hour after the webinar concludes, or look for the link on our YouTube channel in the webinar description. It will contain instructions on how to get your certificate. If you have questions during the live webinar, please type them in your GoToWebinar control panel or email info@johnson-center.org. If you're watching a recording of this webinar, you may email questions to the presenter at info@johnson-center.org. Today's webinar is presented by our Clinical Director, Kelly Barnhill. Kelly is a certified clinical nutritionist with over 15 years experience working with children with autism and related disorders. Kelly is also on the Science Advisory Board and Board of Directors at the Autism Research Institute and has authored several research papers related to nutrition and autism. She is a sought-after presenter, speaking at several national and international conferences each year, and we're happy to have her answering your questions here today. So without any further delay, welcome Kelly Barnhill.
Thanks so much for joining us today. We've gotten lots of questions in before we actually began the webinar, so I can start with those. If you're here now, please feel free to type your questions into the GoToWebinar box or email, as Anissa mentioned. So let's get started. One of the questions that we received yesterday was, why should we be supporting vitamin D and iron? It seems like everyone is recommending vitamin D and iron for support right now. And that's one of the screens that we run routinely for kids when they first come into care, because we like to know where vitamin D levels are and what the child's iron and ferritin status is. And we support vitamin D levels because ideally we like to see those in the range of 40 to 80 on testing, and most of us fall far short of that field. Right now, our I guess within normal limits goes down to about 25. We say that's suboptimal, and we try to, on laboratory testing, and we try to hit that 40 to 80 sweet spot for all of our clients. So we'll support significantly until we get into that range, and then step back and support with RDA nutritionally beyond that, because we know that vitamin D is both it serves a number of purposes, but for immune support alone, because many of the children that we see have immune concerns, we feel strongly about beginning supplementation there. The second half of the question that we got yesterday was about supporting iron, and we look at iron levels also on first screening when kids come into care. Most of the children that we see have sufficient ferritin stores and are not anemic, and they have good iron status, but some children that we see have very low ferritin and they are borderline low iron, or they are anemic. And we tend to support those children well because there's research in the population of children with autism that if you support anyone under, well, let me step back, that ferritin levels under a level of 45, I think, are associated with sleep concerns and sleep status concerns. And because, again, we want to minimize the number of variables that could be influencing the health and behavior of the children that we work with, we support to get above that threshold. We also had a question yesterday about the ketogenic diet. It seems like many people are keto now. And I want to be really clear as someone who utilizes a ketogenic diet for individuals with seizures and also those without seizures with autism, that one ketogenic diet is not another, and what the medical community calls a ketogenic diet looks very different than the ketogenic diet that is so popular right now, because at best what families are doing and what we're doing through guidance on the internet is a significantly modified keto. And I would just be very clear with any treating practitioners or therapists that you're following a modified ketogenic diet, and not label it as keto, because there are very strict rules about following something like a medical ketogenic diet, which has implications, I guess, for both medical and nutritional care. It also, all of the products that are out there now for ketogenic diets, just because we have lots of keto products, as we've seen with the gluten-free craze of the past 10 or 15 years, just because it meets criteria for ketogenic diet doesn't necessarily mean that it's the healthiest food. So paying attention also to the ingredients in some of those packaged products that we now have at our fingertips is important in terms of following a modified keto approach. And for me, that really means looking at increasing healthy fat intake and decreasing certain carb intake. So any processed, refined carbohydrates, as we lower that intake and increase our intake of fats, we shift that ratio of fat to carbohydrate, and we can see good results. Another question that we had was, what are some foods that vegans should avoid or limit? And I would say in our practice, when we work with families who are vegan, the things that we say avoid are very similar to, I mean, it's the same advice that we give every client that we work with, and that is look for real food. And the more processed the product that you're choosing, I would be wary of it. So looking at a packaged and processed vegan diet versus one that's built on healthy fruits and vegetables and supplemented appropriately, I think would be the way to go there. Another question that we had was, what are the safety concerns when you use nutrition intervention? And I think that's a great question. I believe and strongly recommend that families work with a clinician in beginning therapeutic nutritional intervention for their child. And what I mean by that is, it's very safe as a family to work with your pediatrician or family practitioner to add certain vitamins. So a good quality multivitamin that is regulated and approved is a good start. Looking at essential fatty acids and using omega-3s for support with the guidance of your pediatrician is another thing that you can implement. But when you start talking about loading doses of amino acids to treat, or if you start talking about using melatonin significantly and above, because now melatonin can be used in our population, but you really need a clinician who can guide you through what side effects are associated with that, what an appropriate dose is, what the appropriate form is. And I would say that it's you need to work with someone who can help you deal with some of the therapeutic issues. As an example, you also need to be very careful with dosage. So in terms of a safety issue, one product on the market that we use frequently, for example, is a micellized, which means a fat, it's a lipid form of vitamin D support in a liquid for use with kids. And one reason that we use it is because the dose is a drop. You can start with a single drop of this product for 1,000 IUs, and that's a great thing, except you have to be really clear that you're using a drop, not a dropper, because suddenly you're looking at vitamin D excess, and as a fat-soluble vitamin, that can be problematic. What kind of professionals should we see to prescribe and manage a nutrition intervention program? Again, there are lots of nutrition professionals out there, clinical nutritionists, dietitians, many chiropractors have done additional training and are well schooled in nutritional intervention, functional medicine practitioners. It just depends really on the right fit and training for the particular individual, and knowing that that practitioner is comfortable and has full understanding and an expertise in the area that you're looking at. So in treating kids with autism, for example, or focusing on ADHD concerns or looking at GI issues. And I would say don't be afraid to ask the pointed questions about someone's level of experience. How many kids with autism have you worked with? What do you typically do when you're beginning a relationship with a practitioner, so you have full information going in and full knowledge of what their experience and their beliefs are. Do we recommend the GAPS diet for autism? Yes, GAPS and SCD are quite similar. GAPS to me really is an approach that utilizes the basis of an SCD approach and adds on some lifestyle recommendations, changes, and supplements as well. And that's certainly something that we use with clients, and we support with clients who are already on it when they come in. I would say that when I say we use a GAPS approach or an SCD diet, I want to be clear that it's not a blanket recommendation, and it's something that we evaluate carefully for each individual who comes to see us. And we look at many options and recommend a dietary approach that fits the needs of the child and their current medical and health needs. Which that rolls into the next question we have, and that is, how do you know which diet is best? And there are many factors that go into that choice for us. We try to make as many data-driven decisions as we can. So we use laboratory testing, we use dietary nutrient intake analyses that we complete on each client to make sure we're getting what we need in and we're taking out stuff that needs to come out of the diet in terms of processed, packaged foods. Foods that are not what we really believe to be food, as close to a nutritional source as possible. So we work on putting the good stuff in and taking out any non-food foods first, and then we manage dietary intervention from there based on that data that I mentioned. I have some other questions coming in now. Do kids outgrow reactions or intolerances to foods, and how do you know this? I would say that all of us have a tendency to move through and the ability to change our response to food. So it's not only limited to children that they would outgrow something like this. There are circumstances when kids truly outgrow significant histamine response. So allergic responses, we see that change as children's immune systems change and mature. And in terms of intolerances, it really depends on what's causing that intolerance, and that's something that we tease out with a particular child. So for example, if a family feels strongly about running a food intolerance panel or an IgG, delayed immune response panel, that's something that we can order and look at. And the data really tells us, it gives me a picture of that child's overall responsiveness to what's going into their body. So if we get a panel back where we have a child who's highly responsive to a number, 50% of the items that are tested, we know that is, that gives us information that something is going on GI-wise and or immune-wise that makes that child's immune system hyper respond to pretty much anything that goes in. For children who we get a panel back and there are only a few significant outliers, so positive responses, those we know are things we need to look at removing from a child's diet to gauge response. If we're removing foods and intolerance-based foods based on behavior or a physical response, such as eczema, or often you'll hear about kids who are phenol intolerant, getting red ears and bright red cheeks after they eat something that's a phenol food. If we remove those and we kind of mitigate what's going on in the child's physiological status, exposures to phenols may not have that response over time. And the way that you suss that out moving forward is by testing. So by clinical exposure and looking at outcome and doing that in a very careful, methodical way so that you can mark the data and understand what the result of an exposure looks like. Let's see what else. My child does well and is healthier when he avoids dairy products, but I can't get him to avoid it at school or at his friends' houses. What should I do? This is a battle that as parents we all fight, and as practitioners we see frequently. So know that you're in good company in thinking about managing dietary restrictions. And from a professional perspective, I would say that if your child is old enough to make those choices and eat independently, as he or she is, as he's doing now, I would say that he's entrusted with making those decisions. And our experience has borne out that he will have to choose eventually that this is not good for him and recognize that. If he's a very young child and it's a situation where he's just got exposure through school lunch or school snacks, you can request help from teachers and aides in restricting that food intake. But if he's an older child, and particularly our preteens and teens are difficult because they want that level of independence. And it's tricky, particularly in that window as well, because you want to support the growing independence, but you recognize that it's important for them not to have this. So getting their buy-in is what works eventually. And when they own the process, we can be successful for that. And if that means asking for assistance in purchasing dairy-free foods that might be enjoyed, or looking at other dairy-free options, I just, without knowing like what age child we're talking about, I can't give you much more information than that, but I can say that it's about lots and lots of families fight. And overall, I would say that the child has to be involved in making it a success and buying in before compliance will go up. How important is it to limit sugar? I think that's a great question too, because we all eat way too much sugar. I was preparing a talk recently, and someone, I think a colleague, mentioned a fact that 75 years ago we consumed about 4 pounds of sugar a year, and now we consume about 160 pounds of sugar a year individually, and it's become a mainstay in a lot of our diets, and I do think it is the source of many health concerns. So anything we can do to maximize natural food intake, so healthy fruits and vegetables, lean proteins, quality dairy products if you're consuming dairy, and looking at that and minimizing processed sugar particularly. So getting rid of sodas and packaged sweets and significantly limiting that to a way that they're not the core component of our diets, which they are for many people these days. It's important. It's also particularly important in the kids that we see who have ongoing GI concerns because of that carbohydrate source, that sugar source, just feeds the dysbiotic bacteria that we're dealing with. So you have this bacterial overgrowth that you're just providing fuel for if you're not careful. So I would say that getting rid of sugar completely from the diet is an unrealistic goal that most people, myself included, fail at. But managing it so that we're eliminating the focus on sugar and we're paying attention to it. So that would be my recommendation about what's important. Does it matter what brand of over-the-counter supplements we use? Can we switch as different ones go on sale? I would say that that depends. It absolutely depends. You're not really, in many instances, comparing apples to apples. So if one children's multivitamin is on sale and then the next month something else is on sale, those are not the same products necessarily, and their components are very different. The other concern really about buying over the counter is if you don't know the brands and you haven't done your homework and you're not working with a professional who hopefully has, there are concerns with product quality, both with things that are in the product that should not be in there, so contaminants, and also the validity of the label in terms of what they say is in the product and having it actually not be there. And there's some great work out there looking at the nutrition industry in general and split sample testing on multiple products that shows inconsistency across individual lots, and you just need to be really careful. I can't stress enough that being able to place faith in your nutritional support product most are not inexpensive, and having that reassurance that it's money well spent is important, I think. And so I would look for a practitioner or a line that is vetted and individually certified, that a line that's sought outside review of their product, so that you can choose those with confidence. We already see a doctor to prescribe supplements, and he said my child should be on a paleo diet. Is there any reason we should also see a dietitian or nutritionist? That depends. If your doctor recommended a paleo diet based on laboratory work and any philosophical beliefs on what should be going into your child for fuel, I would say that's a good start. But have you done a 3-day dietary analysis? Do you know what your child's anthropometric measurements are? Do you have targets on and growth trajectory information over time, so that we know where we are at baseline when you begin an intervention like a paleo approach? Because I think paleo can be a very healthy diet if it's done properly. There is concern in the community, the medical community, about the use of paleo diets in kids, because many people see a paleo diet as something that's very low carb, but it doesn't have to be. Unfortunately, when you implement a paleo diet with kids, the healthy carbs that you want them to eat aren't necessarily their favorites. So the asparagus and the broccoli and the cauliflower and those vegetables go by the wayside, and their carbohydrate intake declines significantly because you've taken away processed grains by simply starting something paleo. So managing that over time with a level of detail and support is important, I think. So having someone help you design the right diet for your child is something that I think functional medicine practitioners can do, but physicians simply don't have time to sit and spend, and they also don't have the training necessarily to look at macronutrient ratios and micronutrient deficiencies that you want to make sure you manage in an approach like that. So I would say it would be very beneficial to at least get a consult with someone who practices paleo diets with children, so that they can help you get started and do well and not fall into, not get started off on the wrong foot and ultimately create some problems in that process. How can I impress upon dad who thinks we should just let our 20-year-old with autism eat what he wants? He doesn't think the diet is worth it. I think that it's very hard when parents have differing opinions, and this happens frequently in clinic on dietary intervention for their child. And for me, the best test, I guess, is clear data that suggests it's important in the first place. So any data that's laboratory driven that you can provide that suggests a need for a specific dietary intervention is appropriate and useful in making that case. And then really, if you have the ability to collect as unbiased data as possible when your child is on a dietary intervention versus when he is not, I would use that to make the argument that this is an important issue. And that really depends on which diet we're talking about, honestly. So all of us need healthier intake. So even if we're starting with just saying, please no sodas, please don't give him sodas, please don't allow him to have sodas, or baby steps can, I think, go a long way towards making the point and improving the quality of an individual's diet, even if you don't get 100% compliance all the time. How important are supplements if your child already eats a healthy diet? That depends. Is that healthy diet supplying an ample amount of calcium and vitamin D for bone development? Is that healthy diet providing a spectrum of colors, so lots of bioflavonoids for vitamin support? Does that healthy diet meet a child's needs for omega-3s? Because most of us in the United States, and research just came out this week looking at that, we don't consume enough omega-3s, and for kids it's particularly important because we're talking about brain development. So I think it really depends on what your child is eating specifically, but I would say that supplements have a place in many diets, in most diets, and certainly in all diets at certain times. So prenatal vitamins, for example, or probiotics after a course of antibiotics, or omega-3s when we need to support to a certain level. So I would say that supplements are important when judiciously employed and used for a specific purpose for all of us. What else do we have here? For people with ASD who have comorbid conditions like ADD or depression, how do you find a practitioner who's informed on how to use nutrition to address these comorbid issues? I think that most practitioners who work with, so functional nutritionists or functional physicians who work with kids with autism, particularly adolescents, are well schooled and trained in treating comorbid conditions like ADD, depression, anxiety, because that's something that's emerged in the population that we work with over the past 2 decades. So we've learned more and more, and our trainings now skew toward overlap in dealing with these comorbid issues and concerns in both populations. And so I would be entirely comfortable asking anyone that you are thinking about scheduling with, do you have recommendations? What is your experience in working with depression and anxiety in the population of those with ASD? But most of us who work with adolescents in particular have had experience and also professional development training in that area. My son is 24 and seeing a nutritionist we trust and like. She said it would take about 12 months on a nutritionist plan to get full healing effect and behavior improvement. Does that sound like a normal timeline? Yes. Yes, that sounds absolutely reasonable to me, because this is a slow process. We are not talking about the immediate response that you get from certain specific medical interventions. You can see response like that with certain nutritional components, but it's entirely reasonable to recognize that this slow and steady work. It takes us a long time, particularly when we're dealing with adult patients, to get to a place of health where we are, and it takes us time to reverse that and improve it. So I would say absolutely, I concur with that being an entirely reasonable estimate, and I hope it goes well for you and your family. Let's see, my son is 30. He was recently diagnosed pre-diabetic with slightly high triglycerides. He was given metformin for the blood sugar. What else can I do for him besides a paleo keto diet and a plant-based diet? I would say that there are many things you can do to manage and monitor blood sugar. There are several protocols out there, and I can send you, I'm happy to, if you send your contact information to our info address, info@johnson-center.org, I will forward along a copy of one of the protocols that is recommended for management of blood sugar concerns in the adult population. It is something that utilizes products across different product lines, and we look at things like chromium picolinate to manage intake, and curb cravings. We look at other products that are known and researched to mitigate blood sugar swings. And I would say paleo/keto would be a really good place to start in terms of management, and anything you can do to get processed sugar completely out of his diet would be highly beneficial, I think, because we know that that processed white table sugar is just one of the biggest, most significant concerns in driving blood sugar swings. And anything we can do to get rid of that, families will often say, yes, but my child eats a lot of fruit. Well, I'm happy with your child eating lots of fruit if we can get rid of the processed stuff. And then let's talk about the fruit that your child is eating so that we think about those that have lower glycemic impact. And that would be like moving from higher sugar fruit to berries, for example. What can you give a 3-year-old who only eats yogurt and Gerber broccoli and Cheetos? Is there anything other than a liquid multivitamin to help get carbs and healthy fats in? I think that, so this profile of an eater really would fit criteria for what we call a resistant eater, or other researchers move toward other language. So, and I steer clear of picky eating, because in a sense we are all picky about what we choose to eat, and I don't like to label that as a bad thing. So, but a child who self-limits to 3 foods, if I'm understanding and reading this question correctly, has some fairly significant feeding concerns. And rather than talking about nutritional supplementation, I would also say, let's really think through how we expand that diet through a feeding intervention of some kind. in terms of meeting the child's nutritional needs where the child is currently, I would say we need to look at things like definitely an omega-3 support product, which would be a standalone liquid that you could get in. A liquid multivitamin would be helpful, but there are several products now that are out on the market that you might be able to even mix in with a yogurt as you get started. I don't know what kind and what flavor of yogurt the child likes, but there are several high quality medical foods put out by multiple nutrition companies now. So Metagenics is one, Designs for Health is one, and they're medical food support products that carry a variety of proteins, carbohydrates, and fats specifically for children. So that would allow you to get the macronutrients in that you're mentioning in addition to eating micronutrient RDA through a liquid multi. And I think they would be fairly palatable when mixed in with yogurt. I don't know how texturally driven the child is, but if the child likes a smooth texture like yogurt and also something crunchy like a Cheeto, I think that you might have good luck mixing it in smoothly into the yogurt and getting that in to help support with a variety of types of calories and also micronutrient levels. I want to give my daughter supplements, but she won't take pills. What can we do? Well, you have several options. There are really good powder forms out there of several supplements that are palatable that you can mix in with water or juice or milk substitute products. You could go that route. You can look at a liquid, but you've got to be careful with liquids because they often contain sugar. You can look at a compound, so you can compound what you're using into a liquid or a powder, or sometimes compounding pharmacists can become really creative and compound them into forms that kids will eat and enjoy, and they understand the temperatures that supplements need to be held at to be viable. So if you're working with a practitioner, you can have that practitioner write a prescription for a specific type of compound and speak with local compounding pharmacies to see if you could get something like that done. You could work with a behavior specialist on a pill swallowing protocol. That's something that several behavior providers, ABA providers, offer at this point to teach children how to swallow pills, because many of our children are medically managed and we need to get their medication in as well as their nutritional supplements. And that honestly is a fairly straightforward process that moves quickly. Families who are a little bit concerned about teaching pill swallowing really are amazed by how quickly their child will accept and swallow a pill, because well-trained and experienced therapists can make it a fun process that makes things really easy. So I would say those are the options that I can think of right now in terms of managing to get nutritional support in. The one thing that you can do, but just be careful with, is sneaking those supplements into your child through a dietary source. So families will start burying supplements in a preferred food like applesauce or pear sauce or peach sauce or something else that the child really enjoys. And choosing one of those things, I think, to utilize as a mechanism for getting food in is a great idea. I think that you need to be careful, and the caveat is that choose one or maybe two, but a child might start to reject their favorite foods and refuse to eat those things if we try to bury supplements in too many things over too many meals and too many types of foods. We live in a rural area without access to health food stores. We can order some things online, but how can we try to do diet and supplements without more resources? So number one, in terms of diet, I don't know what your area resources are in terms of local farms, markets, grocery stores, But really, we guide families through purchasing healthy fruits, vegetables, and lean protein. And I would hope that you would be able to access those through your local resources there. And that's a huge start in terms of dietary intervention. When you're talking about more specialized dietary products that you may not be able to find, so you want to increase fats and use organic MCT oils, for example, those can be purchased online fairly inexpensively now through Amazon. I would caution you to say that you can also buy supplements via Amazon, but the only way that I would choose supplementation through Amazon is if you know you're buying from the manufacturer. So if you look on Amazon, you will see that the seller is the brand name of the product. So Metagenics, for example, or Numedica. They have certified stores on Amazon, and you can buy safely through those stores, but I would caution you not to buy through a third-party Amazon seller at all, simply because there have been multiple complaints about counterfeit products being sold via Amazon for nutritional support. And to be safe, I would buy only from the manufacturer. Does it matter what time of day you give supplements? Yes, it does. It depends on the supplement and what it's being used for. And again, that's how a practitioner can help you work through those things. Some examples are, most people know you give melatonin at night and just before bedtime. You don't want to give it at other times during the day because you start altering your body's experience of melatonin and production levels and expectation for sleep. So many families will say, well, my child woke up at midnight and I just gave him melatonin. Not a good idea. Dose melatonin once and only once at bedtime. And if your child is waking up, then we need to be thinking about what we can shift and change synergistically to help your child stay asleep. Another example would be using B vitamins, which provide energy. So B6, B12, we want to take earlier in the day rather than later in the day, because if you dose them after, much after school, you're risking keeping someone awake because you've given them energy and support. So I would say, yes, it does matter, and you need to educate yourself and work with a professional who can help you decide when it's best to take certain things. My son has bad eczema. Can diet or supplements help with this? Yes, there is research out there that tells us diet can impact eczema. There are a few things that we can try in terms of elimination and protocols to see if it works or not. From a supplementation perspective, there are a few supplements that have been studied, most notably omega-3 fatty acid support. And I think that a consult with a practitioner who specializes in treating atopy like this or pediatric patients could be very helpful because they can work through a kind of a prioritized list particular to your child on what you can eliminate, how you go about following an elimination diet, and then reintroducing to watch what happens so that you can be as objective as possible in deciding if the work that you're doing is helping or not. I will say that we've worked with many kids with eczema, and we can greatly improve their quality of life because some children have bleeding, weeping eczema that make them really uncomfortable and miserable. And with a little bit more information, we can create a plan that will speak to that and eliminate it pretty quickly. Do I need to be concerned about my daughter's nutrition at all? My son has ASD and we monitor his diet and give him vitamins, but should we do anything for her? I would say absolutely. Particularly in our siblings, we know that there are similar biochemical patterns. We know that they have similar needs and need for additional support at times. So I would say yes. At a minimum, I would think about basic foundational support, such as multivitamin mineral, omega-3 fatty acids, consider probiotics if needed. And I would work with a professional if you wanted to do something therapeutically to help your daughter as well. And I would say that's warranted if you feel like your child has some health concerns like constipation or diarrhea, things like focus and attention that tend to be that we see in siblings. We can assist with that from a nutritional perspective. And those are the things I would target with a therapeutic consultation to maximize intervention for the child. Do we help kids who don't live in Austin, and how does that work? Yes, we help kids all over the country. Anissa quoted a recent statistics yesterday in a meeting, and I think we've seen kids from 49 states and 53 countries at this point. So we help people from all over. For our families who are consulting at a distance or we're working with from afar, it depends on the type and nature of professional support they're looking for. But from a nutritional perspective, ideally, our department would like information from a local practitioner so that we can get accurate anthropometric data and history on growth status. But then, and the ability also to have a practitioner locally that we can recommend laboratory draws for, but that's something that we can consult with via phone or Skype, and we do that frequently. How do I know if my child has some kind of nutrition deficiency? Well, the three variables that we look at on initiation of care with a client are that nutrient intake analysis that I mentioned. So we look at everything that's going in nutritionally, and we get an evaluation that is as honest as possible, a record of what the child eats on an ongoing basis. Then we get laboratory data that tells us, okay, what's the child's actual vitamin D level? How is the child's thyroid functioning? What's his iron status? We can do additional labs that look at utilization of those nutrients and requirements, nutritional requirements of the body. We can often order that data as well. And then we look at the child's overall growth trajectory just to confirm that there aren't any concerns with failure to thrive or overweight, obesity issues. And those things kind of help drive our plan of care and allow us to fully understand an individual's potential nutrition deficits. How big a deal is it to have a cheat day every once in a while when you're avoiding gluten and dairy? It totally depends on the individual. So, and it also depends on what the cheat day looks like, honestly, because we have children who can tolerate a day where they have pizza on pizza day once a month at school because that allows them to be a part of the community without bringing their own from home on that day, for example, with very little physiological or behavioral response. And we also see children who, when exposed to the smallest amounts of gluten, have a terrible, terrible response to that, both from a GI perspective and also behaviorally. We have kids who will have a little bit of dairy and they'll experience significant GI discomfort and be awake all night. So I think it depends on what that looks like. In general, when a family tells me I started a GFCF diet 6 months ago, and then when we start probing, the family will say, well, we started this diet 6 months ago, but we have pizza on Tuesday nights and we have pasta on Fridays. Then for me, knowing the way that gluten is processed through the body, particularly gluten, I know that that's not really a valid picture of what's happening with gluten response in the body. And so we try to get a very clean diet and then decide and start testing those boundaries, as I mentioned. So I would say that I don't think that allowing a child to participate in a meal that everyone else is eating is necessary, and who the child is, when they are, where they are in their plan of care, how long they've been, and that they have no significant health concerns following that exposure. Those are the decisions that I would consider and think about while you're deciding on what a cheat day is and how to include those or not include those. Do I need to worry that the supplements we want to try may interact with my son's medications? He's on an SSRI. Yes, you do, because there are some particular issues and concerns with utilization of supplements, and you want to work with a practitioner that's both skilled in that SSRI usage. So has worked with many clients who are using that particular class of drugs for either depression or anxiety, and also kids with autism if your child has an autism diagnosis, because there are layers of things that need to be considered when evaluating how to bring supplements in with a medical protocol. And that's why we communicate with every practitioner and make sure that we're very open with those that we're collaborating with on our nutritional protocols. And that's why when we develop a plan for a child here, we take medication very seriously, because nutritional supplements are not, it's not as easy as going to the web and asking whether there's a nutrient drug interaction, because it's not as easy to find as you would think. And it's really important that you make sure you have full information before you begin a product that may do great on its own, but in combination with a medication that's already on board could create problems for your child. How important are organic or non-GMO foods? I believe that the cleaner the food is, the better. And to me, that means I want to know, if I can't know that it's met certain criteria to be certified organic, I want to know where it comes from and who grew it or who raised it and how they did that. So I want to understand, like, do they use any products? Does it technically meet criteria for organic growth, but is it not certified simply because that's a costly and timely process? So I think that paying attention to use of pesticides and herbicides, exposure to transit concerns, so degradation of food quality over time based on their transport. Those are all things that I would consider as you think about food. So no, it doesn't necessarily need to have an organic seal on it, but yes, it needs to be grown responsibly so that you minimize toxic exposure to yourself and your family. Do I recommend any particular commercial supplement for ADD issues? There are several out there that we use with fairly regularly. The hard part with just saying go buy this product is that most of them are combination products, and most of them are things that work synergistically if other things are already on board and you know the health status and nutritional status of the client. So I could tell you, please go buy product X. It's $100 a bottle and it'll last 2 months, but without knowing the backstory on what's happening, I could have just sent you to buy a $100 product and you won't have any benefits, simply because your child might not have enough B6 in their diet, or they may not have enough B6 in their multivitamin, which is required to work well with these other products. And so that's kind of the puzzle that we put together. In general, if you want to start supporting focus and attention without playing the puzzle game of what fits where, start with those omega-3 acids, fatty acids. I feel like I'm pushing those a lot now, but if you go to Nordic Naturals and look at their research website, there are multiple studies there on the use of omega-3 fatty acids with those diagnosed with ADD and ADHD, and they'll give you information on the levels of support that were used in each of those diagnoses, so that you can then educate yourself on using a single ingredient nutrient that has a positive result outcome associated with it. And that's the safest place to start, I think, without looking at those complex products that can be really helpful and useful, but you just have to check a few more boxes before starting them. Let's see, I think we have a few more here that I haven't gotten to yet. What is a good age to start a child on a multivitamin? Well, I think we need to begin thinking about our children's diets when they're infants, and often looking at nutritional support in infancy isn't necessarily a bad idea. And the way we really start that is by talking, if the child is breastfeeding, talking to mom about her diet and supporting from there. Usually that means supporting the child with infant level vitamin D and also DHA, because DHA is key for brain development early on in the under 24 months category. In terms of using a broad spectrum multivitamin, I think it depends on the child. If you're talking about a child who's 1 to 2 years old who is in a daycare setting and exposed to multiple other children and illnesses, and you're fighting an immune battle, for example, I think it's really important to think about an immune support protocol to make sure that you're getting, you're supplying the child everything he or she needs to be able to fight those infections well. I mean, this is a normal, healthy part of life, but anything that we can put in there as ammunition to ward off an exacerbated response to an infection, for example, would be good. So that, for me, means I think all of us, we need to start thinking about nutrition from the very beginning. And if that means that we need support, I don't think that it's a bad idea to start thinking about supplementation in infancy and toddlerhood. The next question, this flows right into it. What kind of nutrients should I be thinking about to support my child's immune system? So beyond a basic multivitamin, I would say that you want to look at those single vitamins that we know to be important in overall immune function, and that would be vitamin D. We know that it plays a role. Vitamin E. Also look at zinc, and vitamin C for acute infection. So if your child is sick or getting sick, dosing with an appropriate child's recommended dose, labeled dose of vitamin C and zinc support could be totally reasonable to give them the tools to fight off an illness or to get rid of it quickly if it's something that they have. Let's see if we have any others here. What are the biggest mistakes people make when doing any dietary intervention? I would say that some of the biggest mistakes that we see are those products that we just simply include that are just simply included in a diet because families are unaware that they don't meet criteria for gluten-free, for example, or sometimes families come in with erroneous information on ingredients on a product, and they've been giving their child something that actually they've had a very clean diet overall, and then one component of their intake kind of throws everything out the window because they're getting a dairy exposure every day. So I would say you need to be meticulous in looking at ingredients if you're using products that are shelf stable or prepared. Trust your sources on foods and understand cross-contamination concerns. Those are also big issues. And then I guess just being careful about, particularly in those diets that require a change of typical standard American diet carbohydrate sources, be very careful to look at your child's carbohydrate intake frequently. So as I mentioned earlier, kids often don't really want to eat those vegetables that you're offering them. And so suddenly they move to a diet that is primarily beef or beef and chicken. and that's not healthy for any of us either. So managing that ratio of macronutrients is really important, because you get into a place where you're getting hundreds and hundreds of grams of protein, and you're really deficient in carbohydrate intake, then you're going to have some fairly significant concerns. And I will say that some kids that we've screened on intake who come in on a specific carbohydrate diet or a GAPS approach, and have been following that for a year or two, we see abnormal markers for kidney and liver function on those children, kidney function, because of their skewed intake. So you need to be really careful, I think, in doing that. It looks like we're out of time. That went by quickly. Apologies if I didn't get to a question, if I've somehow missed it here through everything. There are a few that I see I just simply couldn't get to. Email us at info@Johnson Center, and I will get back to you as I can. Thank you so much. Have a good day.